Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. Listen, on this week's episode, we're going to pay attention to my two PA students, Reagan and Cassie. They've been learning about respiratory syncytial virus and the vaccine options that we have in the United States. But I don't want you to hear too much from me. Let's talk to them.
Hi, my name is Reagan. I'm a PA student from Colorado and I'm currently working with Dr. Rutland. Hey Cassie.
Hi, my name's Cassie. I'm a Chapman PA student also working with Dr. Rutland, and I've been lucky enough to work with Reagan as well, so thank you for introducing me, and back to you.
Have you noticed that a lot of our patients have been asking about the RSV vaccine?
Yes, I have noticed a lot of our patients have been asking about the RSV vaccine.
I know that it's important to educate patients on the RSV vaccine because this infection is responsible for an average of 60,000 to 160,000 hospitalizations and 6,000 to 10,000 deaths of people 65 years and older per year, but I don't really know how to discuss this vaccine with them. What do you know about RSV?
Well, RSV stands for Respiratory Syncytial Virus, and it is a common respiratory virus that presents with symptoms such as coughing, fever, sneezing, or even wheezing. Most cases are mild. However, RSV can be serious and lead to low oxygen levels, shortness of breath, and even heart failure. RSV can go from person to person through virus droplets and spread through coughs and sneezes, and you can even pick it up by touching a surface with the virus droplets and touching your face before washing your hands. The vaccine can prevent serious disease, but in order to know that, we'll need to deep dive into some pathophysiology, which Reagan will help us with.
The RSV vaccine works similarly to the flu shot. This vaccine introduces a structural protein, the F protein or RSV protein, into the body, where our immune systems can recognize it as a foreign protein and trigger an immune response. During the immune response, our bodies create white blood cells which recognize an antigen so that if the real infection occurs, the body is able to start an immune response that is faster and can neutralize the virus. But remind me, who can get this vaccine?
The CDC recommends adults 60 and older get a single-dose RSV vaccine, as well as pregnant women who are 32 through 36 weeks pregnant. The vaccine will actually benefit their baby because the antibodies, as long as the mom continues to breastfeed, will pass on to the baby. The CDC reports that an average of 58,000 to 80,000 children under the age of 5 are hospitalized with RSV yearly. Getting the vaccine while you are pregnant can help prevent your child from becoming very ill. Is there anything I should warn my patient about before they get the RSV vaccine?
People with moderate to severe illness should wait for their sickness to improve before receiving the vaccine to ensure their immune system is strong enough to make adequate antibodies. And anyone who has had an allergic response to a previous RSV vaccine should not get it. Side effects-wise, this vaccine is overall well tolerated. Side effects include pain, redness, and swelling in the affected arm, as well as possible headache and fatigue.
Oh yeah, please tell my mom that immediately. Thank you, Reagan.
It's very important for PAs to understand the importance of respiratory syncytial virus so it may be recognized amongst our children and our older population. Most of the time, the PAs are on the front line. They really need this information. The presence of the virus can stimulate inflammation very similar to asthma. RSV can wreak havoc on the vulnerable, which is why vaccination is so important. So if you're 60 or over, go get the vaccine. It might save your life. We'll see you next time.